My name is Liliana Armenta.
Hi, I'm Julia.
You're the beginner, right?
Yes, and I'm super motivated, confident, and I'm ready to learn.
Okay, so today we're going to be learning the motor skill of suturing. Suturing is minimal complexity. It is a fine motor skill because it involves using small muscles in the arm and hand, along with requiring great control and precision with the nylon strings. Suturing is a serial skill because it uses sequences of discrete skills with repetitive movements while suturing along the laceration. And it also is a closed skill because we're in a stable environment where no objects or things are in motion. So since you are a beginner, we're going to be practicing in the lab where you can train and practice your suturing. So we're going to suture to allow you to do the proper technique. And this involves cognitive thinking and assessing what suture pattern to use based on the shape, size, and the depth of the laceration. So before we get started, the overall outcomes that we want you to learn is the motor and the cognitive skills. So the motor is having the skill and the technique to suture lacerations properly and effectively, and the cognitive part being able to think of the strategy and assess which pattern to use based on the size, the shape, and the depth of the laceration. So before we get started, I'm going to show you first on how it should look like. I'm going to be in an objective view from you so that you could be actively thinking while I'm showing you. So while I'm doing this, I'm going to be doing it in the accurate speed in which it should be done. So first, I'm going to get my needle and hook it in the very end of the laceration, poking it through. I'm going to poke it in all the way until the string, there's a little bit left. When it's about this amount, we're going to go ahead and tie the knot. Okay, when your knot is tied, you can go ahead and push it through. Grab the needle again. First, we're going to be pushing it through away from us. So we're going to make sure to grab the laceration of the skin and push it really, really close until it's closed. Where you can get it, push it through deep enough to get some skin, and then pull it straight up. And then we're going to do the same pattern throughout this whole laceration until it's done. Okay, now that you see I'm all done, it's all sutured up. At the very, very end, you're gonna tie another knot. We're gonna tie two. Okay, and after we see that, we can go ahead and cut the excess yarn off. Okay, now that you watched me demonstrate and we watched the skilled model in the video, you're gonna go ahead and perform the skill of suturing. So go ahead and get started. Make sure we knot before we begin the next pattern. Make sure with that non-dominant hand, we're really pinching the laceration to close the wound before we stick in the suture. Very nice on the spacing of the sutures, but make sure when you pull the hook up, it is straight up. nice.
What should I do with my left hand?
So for the non-dominant hand, you want to hold the laceration and pinch it closed while you're suturing.
Okay. How tight should I pull the string?
So you should pull the string until the laceration is completely closed. Hi Julia, I see that you've improved a lot from your first attempt suturing until now. I see the improvement. As for your consistency, I see that your spacing of the sutures are a lot more consistent and your movement patterns have been very consistent. So good job. Okay, now we're gonna be checking for stability. We're gonna put you under some stress. I'm gonna be grading you while you're doing the suture and you are gonna be timed. Are you ready?
Yes.
Okay. Go. Okay, good job. You have successfully completed the skill of suturing under stress and within the allotted time. Good job, you passed. Okay, now that we've been practicing for 10 days and we took a 2-day break period, we're gonna now come back and perform the same skill of suturing, and we're gonna check to see if you're persistent and you could still do the skill successfully after that 2-day period. So go ahead. Okay. Good job. You've successfully completed the task at the same level you did before you left the period, and that gained you the characteristic of being persistent. Congratulations, you have successfully learned the motor skill of suturing. You met all the 5 characteristics of learning, which is you've improved, you've been more consistent, you've been very stable, you were put under stress, you were very persistent, and you were able to adapt. You completed the transfer test, and therefore I can conclude that you've learned the skill of suturing.
Hello, you must be Julia. I'm the 25-year-old intern. I do have experience, but I'm not gonna lie, I do lack motivation and my confidence level isn't very high.
Alright, so I'm going to be teaching you how to be taping an injury. This is a high complexity skill with lots of practicing to understand the technique and placement. Alright, so I'm going to be helping you perfect the taping method on an injury today. This is a high complexity skill that consists of fine motor skills because it involves the small muscles in the hand and the wrist and arm, along with precision with hand-eye coordination, as well as discrete skills because it is an obvious beginning and end to when we are taping the injury. And then this is going to be a closed skill that we are working on because this is being done in a stable environment and it's not going to change when we are practicing this skill.
Okay, sounds good.
Right, so since you are experienced, we are going to be working in a clinical setting and we want to perfect your taping techniques on the different parts of the body. This is going to be involving cognitive thinking and assessing how and which direction to tape and how tight to tape it. And we want to improve your confidence by doing this.
Cool, perfect.
Alright, so for the outcome, since you are an experienced individual, of course we're going to be working on your proper technique, but the overall goal is to improve your confidence that you say you lack and keep you motivated.
Cool. Sounds good.
Alright, so I'm just going to have you sit down and watch what I do. I'm going to be showing you an objective view, and I'm going to be doing it with the appropriate speed, accurate timing, and spacing as it should be performed.
Okay, let's do it.
Right, and then as you know, we want to make sure that her hand is straight when we are going to place the piece of tape on top. And then also, as you know, we don't want to crease the tape, we kind of want to just lay it over. And what this is going to do is prevent her from flexing her hand. And then we're going to place a piece of tape right here as well. Okay, and then we're going to place the piece of tape at the end as well right here. And then as you know, we are going to overlay 3 pieces of tape on top as well. Alright, and then that should be the end product. Right. Nice, making sure that the hand is straight. Nice placement. Nice job that it was wrapped around. Awesome. Right, nicely done. It was done in a professional manner. You taped in the appropriate amount of time and you did it tight enough to where she can't flex her hands, but yet tight enough to where it is comfortable. Right, so now that you watched me perform the skill, we're gonna watch you so that way you can observe your success in completing the skill. Right, so you tore the tape without hesitation. And then although you say you do lack confidence, I see that you're very confident in taping, which is very good. And then you did tape in the appropriate time. And then you're also paying attention to your patient the whole time, which is very good.
Okay, thank you.
All right, so I want you to assess what wrapping technique you are going to use according to her injury and make sure that you secure the tape accordingly. Okay. And then remember to make sure to hold the tape in place with your non-dominant hands while you are wrapping with your dominant hands. And then I want you to focus and be aware of the amount of pressure that you are applying to the wrist when you are wrapping. Right, and then on a more broad scale, just make sure to be aware of the patient as well with her behavior and reactions when you're taping her injury.
Okay.
Right?
Good.
Good job. Thank you.